Good morning and welcome to the weekly COVID-19 video update. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. With us today, we have Robin Schurig, the Director of the Public Health Branch of the Shasta County Health and Human Services Agency. Dr. Karen Ramstrom is the Shasta County Health Officer. Glenn Hayward is representing Redding Rancheria. Mark Mitchelson is representing Shasta Regional Medical Center. Brandon Thornock is representing Shasta Community Health Center. Robert Folden is representing Mercy Medical Center Redding, and Judy Flores is the Shasta County Superintendent of Schools. Thank you all of you for being here to provide an update. I will start as we always do with the data, and today we will be reporting 133 new cases. We've got 620 active cases with 98 people in the hospital. Of those 98, 19 are in the intensive care unit. Unfortunately, we have to report 8 new deaths today. They include a woman in her 50s, a woman in her 60s, 3 men in their 70s, a man in his 80s, and a woman over the age of 89. We will start with an update from Robin Schurig.
Thank you, Carrie. Good morning, everyone. The latest data shows that the CDC 7-day case rate for Shasta County is 408.15 cases per 100,000. So that's down from the 700s a couple weeks ago, but anything above 100 per 100,000 is considered high transmission. So it's improving, but still 4 times higher than what the CDC considers high. It's looking like we may have seen the peak of this current surge around mid-September. We've seen a bit of a decrease since then. This surge began because of the Delta variant, which is much more highly contagious than previous strains of COVID, but that was true in the rest of the state as well, and the state has come out of the surge already and has the lowest case rate in the nation. As I've mentioned previously, we typically lag behind the rest of the state, both in terms of when surges begin as well as when they end, but we're also continuing to see high numbers of cases, hospitalizations, and deaths because of the low vaccination rate in our county. So it's hard to say how long it will take for the rate to improve substantially. We also typically see a peak in hospitalizations lagging about 2 weeks or so behind the peak in cases. So if this trend holds true, we're hopefully right about at the peak for hospitalizations, and we'll start to see those numbers come down, even if just gradually. Deaths, unfortunately, tend to lag another 2 to 3 weeks behind hospitalizations, so we can expect those numbers to continue to increase. We've reported 20 deaths in the past week, including the 8 that we're reporting today. And some of those people have been in their 40s and 50s and one in their 30s. So these are people who had a lot of years of life ahead of them. And even if they also happen to have underlying conditions, the most common underlying conditions we see in COVID hospitalizations and deaths are diabetes, obesity, high blood pressure, asthma, and smoking. These are common conditions and not things that we expect to kill people at a young age. So these are people whose lives were cut short because of COVID. There are currently 98 people hospitalized for COVID in Shasta County, including 19 in the ICU. And as we've reported previously, the vast majority of our cases, hospitalizations, and deaths have been in people who are unvaccinated. Again, the reason we share this is in order to convey the effectiveness of vaccination against infection, but especially against severe illness and death. Our vaccination rate continues to inch up extremely slowly, with the latest data showing 48.6% of the eligible population being fully vaccinated, up from about 48% last week and 46.8% the week before. Still low compared to the state and the nation, and much lower than we would like it to be in order to stop the spread of COVID and prevent new variants from developing. Vaccine remains the most effective way for us to protect ourselves, our families, and our community from COVID and from severe illness or death from COVID, including providing protection to those under 12 who aren't yet eligible for vaccine. Being vaccinated also means you don't need to quarantine and miss work, school, and other activities if you're exposed to someone with COVID, as long as you're not having symptoms. And we want to continue to remind people of the importance of layering on the protection. So whether you're vaccinated or not, other things you can do to reduce your risk of getting COVID or unknowingly spreading it to others include masking, avoiding crowds, especially indoors, and staying home if you're sick, except to get tested. Those are my updates, and I'll turn it over to Dr. Ramstrom.
Thanks, Robin. Good morning, everybody. Today, I'm going to give an update on booster doses. The Advisory Committee on Immunization Practices met last week to review vaccine effectiveness and safety data and the FDA's recommendation for Pfizer booster doses. Overall, the data continue to show the COVID-19 vaccine remains effective against severe disease, hospitalization, and death for most populations. Boosters are indicated for certain groups that the data indicate have waning vaccine effectiveness, which is not uncommon, especially in older adults with many vaccines. There's also a mix of of increased risk and effect on vaccine effectiveness. At this time, the only Pfizer boosters are available. Moderna and Johnson & Johnson booster dose data is pending review at the FDA, and the ACIP spoke about the urgent need to move that forward at the FDA to get these individuals boosted as well. ACIP does not recommend mixing of vaccines in order to provide boosters, though with time, as we learn more, those recommendations may change. The Pfizer booster dose should be given at least 6 months after completing the primary vaccine series. The groups that we're most concerned about providing booster doses include adults living in long-term care settings, people 65 years and older, and people who are 50 to 64 years of age with underlying health conditions. In addition, there's some other groups that might include individuals who are at increased risk of exposure or severe illness based on their individual circumstances and could benefit from booster vaccination. And that includes people who are 18 to 49 with underlying health conditions and adults who are at increased risk of exposure to COVID-19 because of their occupational or institutional setting. Examples of underlying health or medical conditions that increase the risk of severe COVID-19 include conditions such as Robin listed, associated with our deaths in our community. Others include cancer, chronic kidney disease, lung disease like COPD, diabetes, heart disease, obesity, and smoking. And pregnancy and recent pregnancy is also a risk factor for severe illness, and the CDC just reported record numbers of deaths among unvaccinated pregnant women nationwide. So we encourage all of those groups to consider initial vaccine series as well as boosters with Pfizer if that was what they received originally. In addition to booster doses, there's just a reminder that a third dose for immunocompromised individuals is also recommended 28 days or more after the primary series of either Pfizer or Moderna. Making sure that people receive the initial vaccine series continues to be a high priority. That's fundamental to reducing COVID-19 related illness and death in our community. Unfortunately, there's ongoing circulation of misinformation and personal opinions, and individuals jumping to conclusions from one study. This is causing confusion and harm to our residents and communities. So we encourage people who are contemplating vaccination or have concerns about it to seek out reputable sources of information. And if you haven't yet completed your initial vaccine series, we encourage you to do that. And for individuals who initially received Pfizer, especially if you're 65 and older, we recommend that you get a booster dose. Vaccination is the safest option and action that you can take to protect yourself and your loved ones.
Great, thank you, Dr. Ramstrom. We'll go over to our healthcare partners. We'll start with Glenn Hayward, followed by Mark Mitchelson.
Thank you. We've actually had a break this last week and a half. Our testing is down a little bit, which is nice. We're seeing less people coming in to be tested, so I think that's always a good sign. Other than that, nothing else really to report.
All right, thank you. We'll go to Mark next, followed by Brandon.
Good morning, guys. So not much to update from last week. We're encouraged by Robin's data. Hopefully, we're just going to ride the wave and continue to go down in case rate. We're just continuing to manage here. Things are going okay. We're getting ready once we are able to do the booster shots. So we'll begin those clinics again and just trying to keep everybody healthy.
Thank you for your great work on that. All right, Brandon, you're up next, followed by Robert.
Good morning, and thank you. So like the Reading Rancheria, we too have seen a decrease in folks asking to be screened or tested rather for COVID. Tomorrow is the big day, September 30th, as it relates to the vaccine mandate for healthcare employees. And so I do have some updated numbers. I know some of this information was requested last week, but we are up to 78% of our staff are now vaccinated, fully vaccinated. We have another 5% that have received their first dose, but they're waiting on their second dose. And so, you combine those numbers, we're expecting to be at about 83% of folks vaccinated across our staff. The remaining 17%, these are folks who are who are still on leave, so we're still uncertain where they're going to land. We have amongst that group folks who have requested and have been approved for exemptions. We also have a small group of employees who seem to be waiting to the very, very bitter end to communicate with us what their situation is. So anyway, that's our current situation as it relates to staffing and vaccinations, and that's all I have.
All right, thank you, Brandon. We'll check in with Robert and then go over to Judy.
Good morning. So I'll start with some gratitude. You know, we've got so many people, I say it every week, putting their heart and soul into the care that they're providing, but we've got so many people that are working extra shifts or overtime, and can't thank them enough. And it's across the board, almost every job classification, including our physicians. So a tremendous amount of gratitude to them. I do want to report out that we engaged with the MOAC, that's the local medical health operational area coordinator, and we were able to obtain 2 guard units to come help us with this most recent surge. And that really came on the heels last week of the Fawn fire. So I think the morning that the fire started, both Mark and I got on the phone with the MOAC and with a representative from Sierra Sac Valley EMS and kind of said, man, the hits keep coming and we need some help. So we were able to get that help. So it is not a rumor that we have 2 National Guard units here helping us. So we have 2 7-person teams that are actually providing care up on the units. And when they walked in the place, you could just feel the spirits kind of raise and the tension lower just ever so slightly. So we're very grateful for those folks right now. Like Mark, you know, we're all looking at Friday as it's going to be an interesting day. We have a group, last number I saw was 78 people that had not participated in our survey. So that's 78 people that if they don't at least participate in the survey, that will come off our schedule as of Friday. And then we too are starting to see our exemptions come through. So we'll have a lot more information by Friday on those numbers. And then I just want to make a plug. We had a very passionate medical staff meeting last night where the focus was, or part of the focus of the meeting was on vaccination. And, you know, I've reported before that a very high percentage, 93-95% of our medical staff is vaccinated. And again, the questions were, why haven't we done more to promote vaccinations within the community? And I just, you know, I shared the work we've done. I've shared the clinics we've all put together, but there's still this lack of understanding why people won't consider getting vaccinated. So I guess if I had a message today, I'll say that 96-97% of my medical staff is questioning why folks won't get vaccinated. Great conversation. And then I hope that we're at the peak. What my concern would be is that hospitalizations have tended to lag behind community data. So if our past peak was any example of what we're going to experience, I kind of fear that we're still going to see hospitalizations on the rise for the next 2 to 3 weeks. And I will stop there.
All right, thank you, Robert. And now we'll check in with Judy.
All right, well, good morning. Hopefully I have some good news to share along with those from the medical staff who are sharing good news as well. So Shasta County Public Health's most recent data for our K-12 school counts through September 21st show a 14-day average case count of approximately 21 cases per day, which appears to be leveling out at the current case count. And like I said, that was as of September 21st. And yesterday, the report out from the prior 14 days was a total of 156 cases across 50 schools in one office, which is actually a decline of 71 from where we were last week. So last week I shared with you 227, so down to 156. The greatest number of cases continue to come from 13 school sites, but it should be noted that last year at this time, that's where our increase started. And it was due to Halloween parties and other fall celebrations and birthday party events that brought people together. And that mingling was really where we saw the case counts in schools start last year. So it's just a reminder that although we may be seeing the beginning of a decline in schools, the risks are still there. In terms of our point in time data, so yesterday we collected for, I think it's the fifth week in a row, our point in time data. We had 343 students in modified quarantine, which was a decrease of 119 from the prior week. We had 604 students in quarantine at home, which is our lowest by far in terms of the last 5 weeks, a decrease of 310 from the prior week. We have 135 students who are experiencing a positive case, which is a decrease of 84 from the prior week. We have 40 school staff at home on quarantine, which is a decrease of 55. So that's the lowest by more than half of where we were the prior week. And then 32 school staff were experiencing a positive case, which is a decrease of 19. And I just want to share my gratitude to all the schools for their work. It's a tremendous amount of work in terms of covering for substitutes, trying to find substitutes and substituting when there's a need due to staff not able to be there, whether it's due to a positive case or home on quarantine, as well as all their help in gathering this data that I'm able to share with you. And it's great to begin to see these numbers decline, and I'm hopeful that that will continue.
Thank you, Judy. That is great news. Definitely a boost for today, for sure. We are ready for media questions. Anybody have anything this morning? Okay, well, if not, oh, here we go. Okay.
Yeah, actually, I had a question. Sorry about that, Carrie. I just couldn't figure out how to unmute myself. So there's a question for you regarding, well, let me check my notes, vaccinated. Yes, this might be a question for the hospitals, but given the deadline is tomorrow, is there a plan in place for testing for staff? And if are you planning to see people walk off, and will they be fired if they're unvaccinated or they refuse to be?
We've been testing for weeks now, so there was an expectation when the original AFL came out that folks that were unvaccinated be tested on a regular basis. So that's been in place for some time. As far as the Friday's date, our expectation is we'll continue to work with people. However, if folks haven't participated, in our case at Mercy or at Common Spirit Health, if folks have not completed the survey and given us the understanding of whether they're vaccinated or going to ask for an exemption or whatnot, they will be removed from the schedule. That does not mean that they will be terminated at that time.
Okay.
So there's a process we're going to go through. We don't want to lose employees.
Absolutely.
We need we need all of our healthcare workers here in the North State.
And just to echo Robert's statements, that process is really one that every hospital in California is going through. So, we're all doing pretty much the exact same thing.
All the same thing. Okay. Sounds good. Oh, and Carrie, I did have one more question for you. Of those 8 deaths out of Shasta, do you know how many were vaccinated and which ones weren't?
I do not know that information at this time. We do update our vaccine chart on Wednesdays that shows the number of people who are vaccinated versus not vaccinated who have been hospitalized and died from COVID.
Okay, I just wanted to double check with that. Thank you, Carrie.
Yeah, do that. Other media questions?
Hi, can you hear me?
We can.
Awesome. Mike had to step out, but I have a quick question. Do you guys have any idea, if the current surge is on down, on the up, or when you expect it to possibly go down?
Yeah, so I mentioned earlier that we think that we hit the peak in terms of cases around mid-September. So we are seeing a decrease in case numbers, and then hospitalizations and deaths tend to lag behind cases. So it's possible that we're right around the peak in hospitalizations now, but as Robert mentioned, it could be another, couple of weeks, 2 or 3 weeks before we see that peak in hospitalizations. And we expect deaths to continue to increase because they do lag several weeks behind cases and hospitalizations.
Thank you.
Any other questions this morning? All right. Well, thank you everyone for being here. We appreciate your time, and everyone have a safe and healthy week.